I recently cared for a gentleman who had been diagnosed with new type 2 diabetes, and he was there being treated for diabetic ketoacidosis. And of course, he was out of that acute phase of it, but without even realizing it, I was applying Michelle's theory by being the credible authority and the structure provider because I was educating him on how to properly manage his blood sugar. He did express that he felt feelings of frustration and uncertainty with his diagnosis because of all the times we had to keep checking his blood sugar because the doctors had us checking his blood sugar every 4 hours just to make sure that we were keeping it down. So we were constantly checking it and giving him insulin. But I was also able to be the credible authority, and then I was able to provide him with a guideline that we have at our hospital where we actually have diabetes books where we have one that's for pre-diabetes and we have one that's for patients who actually have diabetes, and it has all the guidelines for how they can manage it while they once they discharge from the hospital. It teaches them about their diet, teaches them about monitoring their blood sugar and also the symptoms. So it's actually it was kind of, I don't want to say fun, but it was kind of exciting to be able to educate somebody about something and actually get the positive reciprocation in spite of the fact that he was getting frustrated with, having to have his blood sugar checked so much. He was still reciprocal or receptive to the information that we were providing to him. And he even expressed to me that he was going to start exercising. So I made sure that I bookmarked that particular section, and I told him, because he was a young man. So I expressed to him that it was going to be important for him to monitor his blood sugars while he was exercising. So the patient actually took that as a positive for his outcome. So hopefully he's taking that and he's using the information that he gained to apply Michelle's theory for positive outcomes, so that he doesn't end up having to be rehospitalized with diabetic ketoacidosis again. Hopefully he's taking this for, like, really as a positive way. And then the beautiful thing about Michelle's theory is that it's applicable to all patients because it's generalizable. So you can use it in every diagnosis that's out there. You could use it in somebody who's newly diagnosed with cancer. You could use it with somebody who's newly diagnosed with a kidney disorder. Any kind of diagnosis can be effectively managed by applying Michelle's theory. And that's the beauty of a theory. Like, if a theory is generalizable, then it's an acceptable scientific theory. So Michelle's theory for uncertainty and illness is really, really effective way of managing all of our patients in our nursing practice.